Not that I don't mind.
He's got laptop. All right, it is now 9 a.m. I'd like to call this meeting to order. We'll start with the Pledge of Allegiance, if you please. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, everyone, for the invocation this morning. We have Commissioner Andrews on deck.
Thank you. Good morning. I made the acquaintance of Isaiah Smith about 10 years ago when our respective meditative practices led us to the same workshop. We had both recently arrived in Traverse City after leaving our government lawyer jobs in Washington, D.C., and from that foundation I've come to know, respect, and appreciate Mr. Smith as a deep thinker and an insightful author whose articles address some of the most challenging community and national issues with both wisdom and fairness. So it's my honor today to invite Isaiah Smith to share an invocation.
Good morning, everyone.
Morning.
It's an honor to be before such an august group of people, and I was honored to be invited by the brilliant T.J. Andrews, whom I've long admired. You're lucky that I'm no longer Southern Baptist because we go on for a long time. Our invocation today is really a meditation on the word metta. It's a Pali word, commonly translated as loving kindness, benevolence, or goodwill. It's a core concept in Buddhism, particularly in the practice of loving kindness meditation. Metta emphasizes the desire for the welfare and happiness of others, and is often practiced by extending those feelings to oneself, loved ones, neutral individuals, and even negative people. It is also extended to people in other parts of the world, like Sweden, Denmark, Greenland, and just all over the world, Canada, for instance. So this is a meditation, and if you will honor me, or humor me, just close your eyes, take a deep breath, and think of meditation as extending goodwill to everyone. You can keep your eyes open if you want to, but closing it would be a good thing. As we gather here today in friendship and community, taking a moment out of our busy days and our busy lives to learn, share, and reflect on the insights, experiences, and wisdom of others, we are reminded of how blessed we all are. In the current world around us, there are many who suffer and face grave challenges. We stand in solidarity with them and compassion, and by practicing loving kindness to ourselves and all those around us. Taking a couple of stanzas from metta, a compassion meditation, let us engage in the power of meditation that connects us all, irrespective of religion, with our beliefs and ideals more deeply helping us to hold them in our minds as we go about our daily lives and our daily business, and helping us to develop a stronger sense of conviction. Let us pray the following in the name of all that is good. May all be well, happy, and peaceful. May no harm come to us. May we all have patience, courage, understanding, and determination to meet and overcome inevitable difficulties, problems, and failures in life. May all our parents, our teachers and mentors, our friends, and may all living beings across the world be well, happy, and peaceful. May no harm come to anyone. May they also practice patience, courage, understanding, and determination to meet and overcome inevitable difficulties, problems, and failures in in life. And may you go forth and do good in all that you do in the laws of our country and our local community. Thank you for all that you do. Thank you.
Thank you very much. Mrs. Shealy, if you could do a roll call, please.
Morris? Here. Andrews?
Here.
Nelson?
Here.
Henschel? Spence?
Here.
Walter?
Here.
Flynn?
Here.
McAllister? Seifert?
Here. Commissioner Henschel as well as Commissioner McAllister both reached out. As you can imagine, one's having some issues as a business owner and the other one is under the weather. So, moving right along. So, first public comment. Oh, excuse me, my apologies. Approval of minutes. I did that last week too. Nobody caught me this week. So,
So moved. Second.
Commissioner Walters moved and seconded by Commissioner Flynn. We approve the minutes. Is that a roll call vote? I can never remember.
Who was second?
Second was Commissioner Flynn. All right, all those in favor say aye, please.
Aye.
All those opposed? Thank you. Now, first public comment. Ms. Shealy's going to read the rules, but, so, she's going to tell you that you're going to raise your hand, and I'm going to recognize you by pointing at you. There's quite a few people in the room this morning. I'm not going to do that, so just go ahead and line up, Pastor.
Yeah, we need to
Doctor.
update this. We're going to update this eventually, I hope.
We are. It's on my to-do list, I swear.
Oh, good. Any person shall be permitted to address a meeting of the Board of Commissioners, which is required to be open to the public under the provisions of the Michigan Open Meetings Act. Public comment shall be carried out in accordance with the following board rules and procedures. Any person wishing to address the board may state his or her name and township or district. Providing a specific address is not recommended. Persons may address the board on matters or issues which are relevant and germane to county government as determined by the chairperson. No person shall be allowed to speak more than once on the same matter, excluding time needed to answer commissioners' questions, if any. The chairperson shall control the amount of time each person shall be allowed to speak, which shall not exceed 3 minutes. The chairperson may, at his or her discretion, allow an additional opportunity or time to speak if determined germane and necessary to the discussion. Public comment will be solicited during the 2 public comment periods noted in Rule 5.4, Order of Business. However, public comment may be received during the meeting when a specific agenda topic is scheduled for discussion by the board. Prior to the first public comment, the chairperson will indicate the topics on the agenda for which public comment will be accepted. Members of the public wishing to comment should raise their hand or pass a note to the clerk in order to be recognized and shall not address the board until called upon by the chairperson. The board shall not comment or respond to a person who is addressing the board. Silence or non-response from the board should not be interpreted as disinterest or disagreement by the board. Please be respectful and refrain from personal or political attacks.
Thank you.
Your turn.
Your turn.
Jan Messerschmidt, DO. I put on your desk that the paragraph that got dropped off when the electricity flickered in the library, it belongs under number 2. It's a part of the school program. Maybe this will serve to highlight that in that's where I would start. If I had to develop a program, this is the most straightforward, simple, and it's the hugest part of is just simply preventing these kids from getting on drugs in the first place. As far as a drug dog program goes, why, the kids love it. It prevents the drugs from ever entering the school in the first place, but those kids who have been on drugs, they love those dogs. They are very therapeutic, and they will fight to stay clean in order to be able to handle those dogs. So it's a massive plus. It can also be used at a lot of the sporting events. Over and over, I heard from the kids that many of the sporting events, particularly aggressive form sports that put an emphasis on winning, have huge drug problems occurring in the locker room. They can be used at those events as well, and plus used at like the football games. I've had parents complain about the people from the Pines going over to the football stadium and carrying drugs over there as well, particularly their crack pipes. And that could be another place where intervention in those drug dogs occur. No matter what program you pick out, eventually you have to get to a point, because this money is not huge, and I know it seems huge, but it's not. You have to get to a point to where it can pay for itself. And the drug dogs, I think, can do that in the fact that there are so many schools that can't afford these that are small schools like Cadillac, and you can take this program once you get it controlled in the schools here, you can take it on the road. And the Sheriff's Department has more than demonstrated with the wonderful program that Penny and Chris put on, that they have a great ability to host, here's human trafficking, here's drug trafficking. They can educate the students, educate the parents, and take that on the road with them while handling some of the drug dogs. Those things are really massively important points. I started out in here with pregnant mothers. If you can save the life of a pregnant mother or help them get off drugs, then you're saving 2 lives because you're also saving the life of the neonate. And at the time of birth, that brain function is recoverable. It's at least some part of it. You know, they come out and those poor little new ones are already addicted to drugs. And to try and manage those in the hospital requires a very special person. It's tremendously hard. So if you can address that while the mother is still pregnant and get her into a program and start working on getting her off drugs at that point, you can do quite a bit there to improve the outcome. My thing that I really liked, I don't use the Suboxone clinics. I only made 1 referral to a Suboxone clinic in my entire career. Am I allowed to go on?
Please finish. Yes, absolutely.
Okay, I only made 1 referral to a Suboxone clinic in my entire career simply because the individual came in and said, I want Suboxone and I don't want anything else. And I'm like, okay, go over there. Everybody else I sent to AA. I had fabulous luck with AA in their multi-drug program. One of my people wound up going and signing up for every single AA program in the area because he wanted help every day to look forward to that meeting and to be associated with a mentor who would pull him forward. So if he fell off, and yes he did, he fell off 2 or 3 times, that mentor pulled him right back on board and got him all the way through. I had a few people go through that. They did marvelous, and AA is fiscally responsible, so they use their money well. It's just talking to them about expanding their program to cover some of the aspects that you want, like pregnant mothers. Maybe if you had a division with pregnant mothers and you wrapped around the associated help that they need with nutrition, with many of these other things that they need, including counseling, that's the place to do it. Get them all there, all at once, the whole group of people. We are missing in this community, and I'll put 50 exclamation points behind that. We are missing counselors that deal with this. We are missing people who counsel in the pediatric division. We are missing psychiatry. There are times where I wanted to make a referral. I couldn't do it because there wasn't anybody available. It had to be me. So you wind up trying to counsel these people and their kids through it, and it's very difficult. But not only that, when you're doing this, you're dealing with neurochemistry. And to find, I have never seen a psychiatrist in my entire life pull 1 lab. But you need a psychiatrist who's willing to pull labs, who's willing to look at the neurochemistry and understand what's going on with dopamine and the mu receptor for opioids. They need to be able to do that. So it's going to take finding the right person, and it's going to take an extensive search. People who are going into the business of becoming a psychiatrist or becoming a counselor, they need help on that first year. So if you pull that person here, that's one of the places where you want to spend your money because they're coming out with a tremendous loan debt. In order to get them here, you got to help them out with that first year. After that, they can pay their own way. So it's a self-paying program again. And he's
Can you
going
wrap
hurry
up?
Okay, so
Not to
wrap
cut
up.
you short, I apologize, but
That's fine. The one thing that I really didn't address in here, I think I've covered most of it, is the fact that we need to change the outlook of society in general. Society looks on these kids as losers. They're not. They're really not. I've had some of these kids wound up, I had 2 of them that wind up with master's degrees. And they come in and they've got mental illness, and the parents are saying, my kid is stupid. They're not stupid. It's just correcting the brain metabolism has to be addressed. The other one is addressing the manipulative drug traffickers that can persuade these kids to get on drugs in the first place. So you have 2 points that you have to address as a society, and that's wrapped up.
Thank you.
Yeah, I'm sorry I took more than 3 minutes. I tried.
That's all right. You did great. Thank you very much.
Anybody has questions?
Thank you, Dr. Messerschmidt. Anyone else for public comment? Going once? Oh, there we go.
Hi, my name is Audrey Willette. I'm here because I'm homeless. So, I live here and I'm homeless. So, I'm here to address the issue with the Pine. The Pines are going to be closed supposedly on the 6th of May. I have spent 7 years in this town trying to find housing. The Pines isn't somewhere where we go because we want to. The first night I spent in the Pines, it was the worst night of my life. I had nowhere to go. It wasn't a fad. It wasn't a thing. It wasn't, oh, look at, I'm cool. You know, like, I didn't have a choice. I had nowhere to go. It was the most humiliating, scary thing of my life. You know, I tried to have a chat with the chief of police, and he seemed to think that everyone in the Pines has a place to go, but that was not my case. That's not my story. You know, I'm not here in Traverse City because it's cool to be homeless. I'm just working 3 jobs and trying to make ends meet. I've been trying to find housing, and there are no available housing options for somebody who is 35, who doesn't have a mental illness, who isn't a drunk, who doesn't have 3 kids. I am terrified for my community. I don't want to be here speaking to you. I want to hide in a corner because people judge me because I'm homeless. But I'm here because I don't have a choice. I have to speak for my community because nobody wants to see us as human. I am human just like you. And I am tired of fighting every day for the little bit of crumbs that I get. Because we have created a society where the poor cannot function. Now, is the Pines an ideal solution? No, it's not. It's not great. It's not awesome. It's not a spring vacation. But where else are you going to send us? I asked the chief of police, I live in my van, where would you like me to park? And you know what he told me? Walmart. Walmart. I don't know, Walmart. Well, Walmart will evict you after, I don't know, a month, 3 months. Whenever they get sick and tired of you being there, they evict you. My friend was evicted from the Walmart parking lot. There are not a solution right now. Is the Pines a solution? Hell no, it's not a solution. But it's all we got right now. Until you guys can come together and say, hey, we need more affordable housing for people. Because everybody has a right to affordable housing. People shouldn't have to work 3 jobs to afford housing here in Traverse City. Thank you.
Thank you, Audrey.
Hello, I'm Gray, and I'm a resident. I've come to multiple city commission meetings and talked about the Pines and not evicting, and it's a lot like talking to a wall. And I help some of the homeless residents because they're just as much residents as any other resident in the city. A lot of them do have jobs. A lot of them, you know, they had just one crisis, and we are there's statistics that are 50% of Americans are just one crisis away from finding themselves in the same situation. And it's really hard because this is not anything they wanted, but this is where they are, and they found themselves, and at the very least, they're at the Pines where there's a store nearby, a clinic nearby, it's semi-wheelchair accessible, you know, and there's a busing. It's not ideal, but it's better than what we've tried to find, and when we've tried to find other places, they immediately get evicted out of there. And I've helped move somebody like twice just trying to find a new place for them to go, and we can't find anywhere for them to go. And like housing, I've had a housing advocate before myself, and they've told me I'm looking at a 2-year wait list. That's the situation with a lot of the affordable housing here, is that there's years waiting, and you've got people who are getting in crises and find themselves homeless. It's never going to end. It's never going to stop. There's always going to be new homeless people, even if we found every single person housing in that situation right now. There's going to be people following them. So at the very least, we need more of a plan. Right now, the city does not have a plan. They say they're working on something, but there's nothing. And they're trying to just drop this date, May 6th. We've got people freaking out and scrambling. And I'm trying to do like crisis assessment, and I'm not in the place to do that. Like, I've only been at this for like 6 months, maybe. I'm not in a place to be handling people's crises. I am not good at this, and it's really heartbreaking to see people have to do this. And they're my neighbors, and they're my friends, and they have families, they have stories. They're wonderful, beautiful people out there, and they give back as much as they can to me as well. Like, they want to cook for me, they want to do anything they can, and I don't know. I really urge the county to come to the city commission asking for at least like some sort of delay or better plan. Then, get people in the Pines involved.
Thank you, Grace. Anybody else for public comment? All right, we're going to move along. Thank you, everyone that spoke today. We're on approval of the minutes. Agenda, excuse me. It's a good thing you're here, Bonnie. So the approval of the agenda, look for a motion to approve the agenda.
So moved.
All right, second?
Second.
All right, a motion by Commissioner Flynn, second by Commissioner Andrews, to approve the agenda as presented. Is this a roll call vote?
No.
Sweet. All those in favor say aye. Aye. All those opposed? All right, thank you. To the consent calendar.
And this will be a roll call vote.
Thank you for the heads up on that.
The purpose of the consent calendar is to expedite business by grouping non-controversial items together to be dealt with by one commission motion without discussion. Any member of the commission, staff, or the public may ask that any item on the consent calendar be removed and placed elsewhere on the agenda for full discussion. Such requests will be automatically respected. If any item is not removed from the consent calendar, the action noted, receive and file, or approval, is approved by a single commission action adopting the consent calendar. A, receive. Number 1, Traverse Area District Library, February 2025 meeting minutes. Number 2, Department of Health and Human Services Pavilions Board, February 2025 meeting minutes. Number 3, Kingsley Township annexation. Number 4, Community Development Block Grant Loan Program, Warbird Protection Group. Number 5, Grand Traverse Conservation District, March 2025 report. B, approvals. Number 1, broadband grant funding support letter request from Point Broadband. Number 2, lease agreements for 500 West Front Street and 851 Woodmere Avenue. Number 3, reappointment to Grand Traverse County Jury Board. Number 4, board and committee appointment recommendations. Number 5, waiver of attorney-client privilege of February 28, 2025 opinion regarding terms and residency requirements of members of Board of Public Works. Number 6, resolution in support of Antrim County's request for separation from the 86th District Court.
Thank you. Is there any items that would like to be pulled from the consent calendar at this time? Go this way. Commissioner Nelson?
B1.
One. Mr. Walter?
A4.
4. Anybody else? All right, take a motion to approve the consent calendar as approved with the pulled.
So moved.
Second.
All right, motion by Commissioner Nelson, second by Commissioner Andrews. So roll call vote, please.
Andrews?
Yes.
Nelson?
Yes.
Spence?
Yes.
Walter?
Yes.
Lynn?
Yes.
Morris?
Yes.
Seifert?
Yes. All righty, so seeing that we don't have any special orders of business, go right to A4.
Thanks. I was hoping Laura could come up and just give us a little more information on the item regarding the block grant situation. I can't remember, I remember when we approved it, Laura, but I can't remember the timeline that is sort of required since we approved that loan about 1.5 years ago, and then it hasn't been fulfilled yet, and sounds like things are changing in terms of the business plan. Can you just give us a little more information about when that, if there is a date that they have to have hired those people by and that are, proven to be Grand Traverse County residents?
Yes. Thank you, Laura Galbraith, President of Venture North. We do manage the revolving loan fund for Grand Traverse County. So Warbird has 2 years from the time of when we came to the public hearing and approved their request. So that was November of 2023. So in November 2025, coming up in the next few months, if they still haven't created those jobs, then we would either have to come back to the county for an extension request, or we would have to figure out how to repay the county for that loan, that particular loan amount. I think that the business had, as the memorandum states, things changed and they had to pivot. They are in discussion with a lot of their former customers, and they have an opportunity to operate out of Kalkaska location. And I think that was the purpose of bringing this to your attention, because the business is relocating to a different county. But they do have a pretty sizable job creation goal. This is over a 5-year period. But in conversation with them, they feel that they are going to be able to create the 5 jobs that they promised Grand Traverse County. And so as we're monitoring the jobs that are created for this particular project, we would pay attention to those employees that would be Grand Traverse County residents, and make sure that they meet the requirements of the loan program.
So is it fair to just have you come back in December maybe and give us an update? Because it sounds like they
Yes.
have to have that completed by November.
By November.
Have
We would-
hired those Grand
Right,
Traverse
we would
County people.
probably come back to you by November
Okay,
with more updates.
that would be great. I'll
Great.
move to receive and file unless somebody else has a question.
Nope. All right, motion.
Thank
Commissioner
you.
Walter, receive and file, seconded by Commissioner Flynn. Is that a roll call vote? No. Sweet. All those in favor say aye.
Aye.
All those opposed? Okay.
Do we
Very
need
good.
a motion to request that we receive an update before, say, December 1st? Or is,
No, we will coordinate with Laura, and we'll make sure that she's available in a meeting in November.
and just to follow up, it says there's a closeout public hearing required under these grants. When does that normally take place relative to that 2-year period?
Laura, can you comment on that?
Yeah, the closeout would be at before that November 2025 timeframe, or we would be coming to you for an extension. Those are the options.
So it's built in that we would see you again before the end of this?
Yes.
Anything else? Thank you for your time today. So B1, Commissioner Nelson.
Yeah, thank you. I guess I have a question, if I may. Is there anybody here from pointbroadband.com? Or maybe even administration might be able to answer the question, but I want to know what part of the county, what territory, what roads, or if they have a map they're looking at. My concern is if they apply, they're a company out of Alabama, Opelika, Alabama. If they're just coming in and grabbing a territory, and maybe from someone else that's planning on doing that same thing to get ahead on the money, I don't know. I understand that it can work that way with some of the bigger companies. So maybe administration can answer the territory or anything? Because I don't really have a lot of information here.
This is what we have, Commissioner Nelson. We did not get any type of a map from Joe. What we can say is this is a competitive grant that many vendors are seeking, so I can't answer the question.
Yeah, I guess that'd be my concern for my fellow commissioners is that if we have another local company that might be coming in, and I don't know that there is or there isn't, I'm in favor of these broadband BEAD grants,
Yeah,
but
I agree, we are as well, but in addition to your concerns, I believe the grant period has already gone by. So I think the letter is late.
yeah, I think it was,
I believe it was the 9th of April.
yeah.
It was last week.
Yeah, so that was kind of confusing to me too, but,
So, it's your pleasure. We did include this. We told, if I'm not mistaken, we did tell Joe that it was going to be late, and we had already had the meeting, so it would
Okay.
be,
So I'm going to ask if we just receive and file the request, does that require, and we don't have to write them a letter?
This one is an action.
That won't achieve what they've asked us to do.
yeah,
Yeah.
a declination is certainly an option at this point in time. I believe the time frame has passed.
and I'd be uncomfortable supporting this without knowing more information. I'm happy to undertake that research. I didn't have time before this meeting, but
Nor did I, and I share your same concerns. It's like, I appreciate it. It is a competitive grant. We've had 2 letters already of support for other companies. But and I believe that those 2 letters of support were for actually areas that were contiguous. They weren't actually overlapping or very small. And I don't, I'm all about supporting more rural broadband, but I'm kind of curious as to where they're planning on or if they're already in the area too. So I'm going to look for some, I'm just going to let it go away. I don't want to approve an action and letter of support
We,
personally, without more information. Go ahead, TJ.
we supported last week or last meeting the PFN request without any additional information than what's being provided as requested in this application. We didn't have a map, we didn't have a location, we didn't have any information indicating it's the April 2nd. It was in the consent calendar item
I believe
B6.
Isn't that the one we had the map and the agenda setting?
Nope, that was
There's another one.
That was another one.
The one before.
So and whether they're late is their problem, not ours. It's not a reason, in my opinion, to not provide a letter of support. I don't think our concern is to pick among the companies. It's to ensure that our residents get service, get broadband service, and if the BEAD grant application reviewers want to take into account as many competitive grants as they want, and I don't know why we wouldn't be supportive of that in my perspective. This one is no different than the one we approved in the consent calendar last week, and there's no good reason to distinguish it based on the lack of information or where the company is located. So with that, I'll make the motion to approve the request for letter of support for Point Broadband.
Second.
All right, we have a motion by Commissioner Andrews and a second by Commissioner Flynn to approve.
So the letter does say that it includes parts of Grand Traverse County. If you remember the first map that we saw, those parts of Grand Traverse County that were part of the BEAD was the far eastern portion of the county and the southwest corner of our county.
I believe that letter there was Peninsula Township.
No, it was Peninsula Fiber. Remember Peninsula, the map? They just showed their jurisdiction, not where they were seeking to expand, and that was the first one.
Fair enough. Good point. All right, so we have a motion and a second. Any further discussion? Roll call vote.
Nelson?
no.
Spence? Yes. Walter?
Yes.
Flynn?
Yes.
Morris? Yes. Andrews?
Yes.
Seifert?
Yes. Thank you. Thank you, everyone. All right, department items 9A.
Good morning, Commissioners. Our newly appointed director of our central dispatch, Corey, is here to talk to you about the termination of the regional 911 collaboration. Corey, would you like to come to the podium?
sent us an email telling us that.
Good morning, good morning. Before anything else, I just want to take 1 minute and recognize that this week is National Public Safety Telecommunicators Week, and that's the week that we celebrate the people that actually do the good work of taking the emergency calls and sending out the first responders to those emergencies. So we're having a good time up there this week while still doing the work. And all that to say, we appreciate your continued support. All these technological things only work if we have the people to work them, and you have to have a special kind of person to do that job, and we do. We have some really special people here, a great team. I would say one of the best in the state of Michigan is our team here at Grand Traverse, and we appreciate your continued support for them and the mission that they perform every single day. The item that I have before you today is a termination of an intergovernmental agreement. So back in, I believe it was 2018, we collaborated with several other counties and several other dispatch centers, going from here all the way up to the Mackinac Bridge. And what this collaboration was an application for an FCC grant so that we could all upgrade our 911 call-taking systems. So this is basically a phone. But instead of everybody having redundant technology, we could have 2 spots in the area that would have the core technologies. So it'd be Grand Traverse and Petoskey. And then the smaller centers in between could just kind of share off of our technology. And it was a great idea. We saved a lot of money on it, but sometimes you get what you pay for. It hasn't worked very well since the beginning. There have been problems across the board. Our intergovernmental partners, many of them are leaving, and they have given us notice, both informal and formal. So that would be Kalkaska has given us notice, Wexford has given us notice, Antrim has given us notice, and we're still waiting for one other partner to make a decision on that. According to this agreement, they only have to give us a 90-day notice, but we, as one of the central hubs, have to give a year's notice, a 12 months notice. So what I'm asking as a commission is that we give that notice and then begin the work of finding a replacement system. Happy to answer any questions.
Any questions for our new director?
Deputy or new?
Brand new, effective this week. So we went through an application process, and it's always nice to have internal candidates that are qualified and capable, and Corey certainly fits that bill. So
I have big shoes to fill, and he was a lot taller than me, but I'm going to do the best I can.
All right, Commissioner Andrews. Oh,
Congratulations.
Thank you.
Thank you for your presentation. I do have a couple of questions. I understand that what's in front of us is a termination of a 2018 agreement. My review of that agreement is that there were 2 entities that signed it. It was us and the CCE, the Sheboygan-Charlevoix Emmett Authority. I don't see, and those 2 entities have responsibility to each other and to maintain this equipment and all the rest. And as I understand it, those 2 entities would have a 1-year obligation because they have the equipment, and that gives the other entity time to find other backup equipment. What's confusing to me is I don't see Antrim, Kalkaska, Wexford, or any other counties as being parties to that agreement. So I don't know where their obligation to provide us any notice comes from, or how they're impacted by our decision to terminate this agreement. I also understand, so that's one question. I'll lay out a couple. Another question is, it looks to me like the obligation to provide 1-year notice doesn't apply. If there's only one entity left in the agreement, then the agreement by itself terminates. From what I understand, once all these other entities have given notice, there is only one entity left, which is the CCE up in Petoskey. So I'm not sure we have to even do that at that point, but that doesn't appear to be contemplated here. My third question is going to be, it feels like it seems like there's a discussion here that this is one step towards a replacement system. What concerns me is that we have no information about the replacement. We have no cost, we have no timeline. I mean, the timeline is later this year, but I don't recall hearing about that in the budget last year. I did review the budget from last year, and I see no discussion about it. So can you give us some context for the larger plan for the replacement so that we understand that by doing this, what's coming next?
Yeah, so my understanding, I was in a different part of this intergovernmental agreement when in 2018 when we signed on, so I was actually with Antrim County at the time, and my understanding is that the fiduciary responsibility was Grand Traverse and CCE, and then the other smaller centers just came on after that. That is my recollection, but I was not here at the time, so I may have that incorrect. As far as the replacement system, we've already started to get budgetary estimates for what this would impact. I'm anticipating that this would be a 2026 purchase, so we would put this into the 2026 budget items, and we're going to go through the RFP process to get that. So once that process gets rolling along, we could find some numbers. It's not going to be free. It's not going to be inexpensive, but I don't think that it will be prohibitive. Taking a look at what our financial situation is right now. Currently, we are paying this company about $16,000 a year for maintenance. They don't do a very good job at maintenance, but the budgetary estimates I'm seeing come in from other vendors are either just below or just above that. So it's going to be about the same yearly impact for maintenance, even if we go with a different vendor. And then the financial impact of installing a new system, so purchasing the new equipment and installing that, we're still getting those numbers in.
Do you anticipate a collaborative effort going forward, or is this going to terminate the collaboration aspect of this project?
Collaboration at this point is going to be impossible. From what my understanding, CCE up in Petoskey, they're going to stick with this system. They're just in a position where they don't have a choice, and then everybody else is leaving, and they've already found other vendors.
Are there FCC grants available to cover any of that capital cost?
No. So this particular FCC grant that came up about in 2018, a lot of us had old legacy systems that were still based on landlines, things like camera trunk and copper wires coming in, and the FCC made a nationwide push to get everybody up to what's called Next Generation 911 or NG 911, so that we could handle a more of a fiber infrastructure, and eventually have enough broadband coming in that we could handle things like text messages and even video, those kinds of things. And so that was the big push, and that's where the FCC grant came at that time. The whole state of Michigan is upgraded to NG 911, and most of the country is at this point, so those grant opportunities have dried up.
Good. Any more comments, questions, concerns for the new director, 911? That's not going to get old, me saying that for a while, Corey, because I'm going to obliterate your last name. I'm just going to call you, hey, new director, what's up?
Every time I hear it, I look around to see if Jason's behind me.
Commissioner Spence.
I'll just say congratulations to you as the new director, and it's a privilege to serve on the 911 dispatch committee.
Thank you. Anyone else? All right.
And with that, I'll make the motion to terminate the intergovernmental agreement for NG 911 call handling system project originally approved March 9, 2018, effective on May 1, 2026, and to authorize staff to communicate this termination to collaborative partners as required by the agreement.
Second.
All right, motion by Commissioner Andrews, second by Commissioner Flynn to approve as presented. All those in favor say aye.
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 All those opposed? Thank you, everyone.
Thank you.
Thank you, sir. Going on to 9B.
Right, 9B, Mr. Leahy, our Deputy Director of the Health Department, is here to discuss with you the Hub of Community Connections. And also in the room today, we have Dan Thorell, Health Department Director of Benzie Lima.
Good morning, Commissioners. Mike Leahy, as Administrator said, Health Department. And I have two willing guests with me, so I'm going to let them introduce themselves.
Hi, I'm Debbie Aldridge. I'm an Assistant Director with the Benzie Leelanau Health Department and Director of our Northern Michigan Community Connections Program.
Hi, and as Nate introduced me, I'm Dan Thorell. I'm the Health Officer for Benzie Leelanau District Health Department.
So I was going to take a moment here to set the stage as to why we're here and who's all here. And then I was going to give way to Debbie here a little bit to give a little explanation as to what Community Connections is. And actually, I'm going to see if I can get the slides up on the screen here.
Apologies, Michael.
Oh. Thank you. So, Community Connections, I had intentions to come here and seek approval for this contract by myself, but I felt it pertinent to take a step back and invite our partners to the table too, Benzie Leelanau District Health Department, and really, sorry Dan, but Debbie really has Debbie really wrote the book on some of it, so I wanted to give her an opportunity to give an explanation as to what the program is, how much of a benefit it provides to our community here, our residents in Grand Traverse County. And then I do believe we found a good solution to a problem that we had identified late in 2023. So today we're here asking for approval to enter into an interlocal agreement or a contract with Benzie Leelanau to support the services of this program. We have grant dollars at the local health department that we've identified to use for that support. We just need the support from the board here today to enter into that agreement. So in 2016, the inception of Community Connections was established. At that time, it was determined best that the hub of Grand Traverse County was going to work out of the Benzie Leelanau District Health Department. That's why our partners are here today. And it's worked very well since that time. We've run into a bit of a funding shortfall with the State Health Department, Michigan Department of Health and Human Services, but we are working together to make sure that we can identify funding now and into the future so that we can sustain this program. So with that, I'm going to step aside for a moment and let Debbie kind of explain what this program is and the benefit it is to our community. So.
Thank you, Mike. Oh, that's okay. So yeah, as I said, I'm Debbie Aldridge. I am a nurse. I don't think I said that earlier. I've been involved with this program since it started back in 2016. It was started with just 10 counties in Northwest Michigan as part of some Shire funding, Community Health Innovation Region funding. It then expanded, as you'll see on the slide, to cover the whole 31 counties in northern Michigan. It is a public health model. So these are all, each of these hubs are run through public health. Do I advance the slides? Okay. So what is Community Connections? It's a free program. It's for anyone. We work with adults, kids, seniors, families, whatever combination. We address social determinants of health. So things like housing, transportation, physical health, dental, mental health, anything that can get in the way of someone being healthy. Most of this work is done with community health workers. And so community health workers are, they're like peers. They've been through an intensive training program to get the skills they need to work with folks in their home. They're all certified by the Michigan Community Health Worker Association, who provides the training. And then they're also supported by nurses and social workers in the program. So when we get a referral for the Community Connections program, we get them lots of different places. Hospitals and healthcare providers, you've probably been to the doctor and had to fill out screening questions. Do you have enough food? Do you have a place to live? So if anyone responds yes to those questions and yes, they want assistance, those come to the Community Connections Hub automatically to be addressed. So we get them from physician offices, we get them from community-based organizations, we get self-referrals, people who have been enrolled in the past and come back to us, or that they heard about it from a neighbor or a friend. A lot of the community-based organizations, we get referrals from Father Fred, from DHHS with CPS or APS. We get them from the Area Agency on Aging, from Dental Clinics North, from the Cowell Cancer Center, from TCAPS, from the street outreach folks, from the QRT team as we're talking about the housing situation. We get them from that quick response team. We're a part of that. So referrals come from a lot of different places. When we get the referral, we reach out to the client who was referred to find out what their needs are and see if they're a good fit for this program. And then if they accept services, they're assigned to a community health worker who then schedules a visit with them. And we provide feedback to whoever the referral source was, letting them know what the outcome was of that referral. We're an evidence-based program, so we're certified by the Pathway Community Hub Institute, which was originated in Ohio, and now it's a national program. How we're a little bit different, like everybody's heard about 211, and 211 provides a lot of great resources and access to things. How we're different is we're a home-based program, so it's really relationship-based, home-based. 80% of our visits have to happen in the home. And these are our pathways, so when we do the first visit, we do a deeper dive assessment of what their needs are and what they want to work on, and then these are the different pathways that we open. Each of these pathways are closed either successfully or unsuccessfully, and we track those, and each one has a different successful outcome. So if we're working on behavioral health with someone, they have to keep 3 appointments related to their behavioral health before we can close that successfully. If it's housing, they have to be housed for 30 days in safe, affordable housing before that's closed successfully. If it's a medical home, they have to have that first appointment with the medical provider. If it's food, they have to have food without community health worker assistance, adequate food for 30 days. So it's not just giving them a referral or a resource, it's really helping them get the need identified, get the need met. And then if we're not able to meet it, we track those reasons also. Is it because there wasn't resource available? Is it because they weren't eligible for the resource? Is it because we lost contact with them? So we track all of those, and those are all shown on our website also. These are just a couple of screenshots of our website. This is how anyone can make a referral, where you just choose what county you're in and click the button, and if it's a self-referral, there's some questions it asks about what your needs are. If it's a community organization doing the referral, they can just select what they're sending the referral for. There is a QR code there you can scan to get directly to the website, but that was just a screenshot of that. This is an example of kind of why we're here. You can see there's our referrals going back to 2021, and you can see that our referrals have really increased, and the percent that our Grand Traverse County have really increased also. This is another screenshot of the website that you'll be able to go to. So on the website, we have everything, like top thing that you'll see is from 2024, all of our referrals. And so you can also sort it. So this is sorted to just include Grand Traverse County. You can look at the whole region. You can look at by hub or by county. So this is Grand Traverse County. You can see our referrals by age. So most of our referrals are 20 to 40-year-olds. You'll see as the top ones. And most of our referrals do have Medicaid. So I said that we're a universal program. Medicaid or Medicaid eligible is our top, kind of our target audience, but we don't turn anyone away. We are seeing more Medicare referrals also now that the hospitals are screening and referring. And these are our referral reasons. So you can see the top reasons are housing and food, which is probably not a surprise to anybody who's been, talking to folks in the area, that those are the big needs. Transportation is another one, employment, and utilities. So we do a lot of helping folks just with My Bridges application, sitting down with them, helping them create an account, helping them apply for emergency services assistance, for shutoffs for utility notices, or for getting medical insurance or food benefits. Some of those folks are only enrolled for a short time. We do the assessment, we help them with whatever they need, and then we close them. They're able to handle stuff on their own. Others are open for a lot longer. Some are open for a whole year. We're meeting with them at least monthly to help them with whatever their needs are. And I should say, we don't have money in this program. It's really about connecting folks to resources. So we work with lots of different folks and lots of other community organizations to help folks get what they need. We've had several different evaluations done that show the impact, and all of these are available on the website also, the studies that were done. But important to note, the cost savings, $3 million was saved in by Medicaid health plans for folks that were enrolled in our program, and that was back when it first started. So just looking at ER visits and inpatient stays, with everybody that we see, we ask them if they have a primary care provider, have they been to the dentist, help them with those kind of resources that we see a lot of folks going to the emergency department for. Expense reduction, so $1.21 averted in medical costs for every dollar that's spent on navigation services. And then increased self-efficacy. When we did a survey, 80% of the clients who were enrolled felt like the next time the same issue came up, they'd be able to navigate it themselves. So it's really, doing it with them or for them, and then they're able to do it themselves. And this is just a little more information on the claims data, that study that I talked about earlier with the decrease in costs. And the last thing I just want to say is we do have a lot of success stories and a couple of examples of those, and it really is because we're in the home with folks, so it's different than just talking on the phone. And sometimes, you meet with them, you help meet their need, and then other needs might come up as a part of that. There's one gal that was referred for housing because she was going to lose her house. She had unpaid taxes that she hadn't paid for a long time. And we were able to work with her and find some programs where she was able to get some of those back taxes paid and able to keep her house. But as a part of that, it came out that part of the reason she was in that situation was because she just wasn't opening her mail because she was so overwhelmed with it all, just didn't want to deal with it. And then it came out that she also had some substance use issues and was drinking a lot. And so this gal, besides helping her with the house and being stable with that, they were also able to get her into treatment and be able to help with that. There was another gal who we were working with and helped her, and she wanted help getting a hearing aid. And so, going through that process and figuring out what insurance would pay for. But then also come to find out she had somebody living in her house who she didn't want there and couldn't get to leave. So kind of a squatter that was there that she couldn't get to go. And ended up being involved with Adult Protective Services and the Michigan State Police, and were able to have that person removed from her home. And she hadn't told anybody else that was a problem. We had somebody who hadn't showered for over a year. She was doing sponge baths and that kind of thing. She had a shower, had the facilities, but had some physical things, and she couldn't figure out how to make it work to be able to safely take a shower in her shower. And this community health worker was there, and, let's take a look at it. Let's see what we can do. They figured it out, and she was able to take a shower, and she was so appreciative of that. So those are just some examples of some of the things that we've been able to help with. And I will pass it on to Dan now.
Okay. All right. Good morning, everybody. Good to see some familiar faces. Just to give you a little context, I worked for Grand Traverse County for 20 years in environmental health, and I remember when Debbie came and did a presentation when Community Connections first started in 2016 to our staff, and I used those resources as an environmental health professional to connect people with resources when they had problems with their wells and septics and whatnot. It recognized early on that it was a great program and really helping people. And I can tell you that it's heavily used by other health departments throughout our region. And Grand Traverse County is, no different than that. I think it's heavily used by Grand Traverse County Health Department staff. But just kind of talk about our funding timeline a little bit and where we're at now and where we need to go. Give a little context, just backing up a little bit. It did start in 2016 with some funding from MDHHS, but prior to that, Governor Snyder back in 2015 identified that, there needed to be something different done with healthcare and Medicaid in the state of Michigan. And so there was some funding that was awarded for a state innovation model. And what this did is it took it looked at the healthcare system overall, but it also looked at population health. And this is where the social determinants of health came in, and where Community Connections was really born out of, as the Community Health Innovation Region was started during that time with that funding. And, this is just one of the successes that came out of that. And I will say that, we are the only shire in the state out of 5 that serves a rural population and is led by public health. I'm a little biased, but I think we're the best in the state. But anyways, in 2018, we started engaging with Medicaid health plans to have contracts with them to get funding to serve their population. And we are continuing to do that. It's been a little bit of a a rocky road because the state went out and did an RFP, and all the Medicaid health plans, most of them changed, right? And so we've been renegotiating contracts, and it's been a little bit of a process. In 2021, we received some additional funds from MDHHS, which was great, but in May 23, all the funds from the state pretty much dried up. We had a projected shortfall of $220,000 for fiscal year '24, which obviously was going to be a huge problem. And at that time, I reached out to administrative staff at Grand Traverse County Health Department to kind of talk through that and see what we can do. Thankfully, shortly after that, several small grants came into play. It covered the shortfall through fiscal year '24, and we ended up only about $24,000 where we had to use local appropriations from Benzie-Leonard. Again, we're kind of in the same boat this year. We're looking at, when we first put these slides together, we were looking at about $138,000 shortfall. That is inching up closer to $200,000, given recent federal spending cuts and whatnot. We had some CHW time in schools that were affected by that. But again, reaching out to, communicating with Grand Traverse County Health Department, and thankful to Mike for moving this along and trying to help find some solutions to this problem, because this is definitely a program that we value, and we want to continue to see it something that's available to Grand Traverse County citizens. So, our overall budget, how do I advance the slide? Yeah. Okay. Really, the overall expenditures for the Grand Traverse Hub are at about $726,000 for fiscal year '25. And that really doesn't even capture the true cost, because a lot of the administrative work, grant writing, things like that, we're absorbing, because we cannot put it in the budget because it would just make things worse. We're revenue projected to be about $588,000, and that is reduced since some funding cuts. But we're continuing to see grant funding. I mentioned the Medicaid health plan contracts and having to renegotiate those. We're making some headway there. And Debbie is really done a great job with that. She's also not only just at Benzie-Leonard or the Grand Traverse Hub for Community Connections, but she is the director of all the hubs throughout the 31 counties in northern Michigan. That's over 800,000 people. If you think about it, it's a lot of services for a lot of people throughout all the hubs in northern Michigan, 31 counties. And really what makes up the budget if we don't have the funding, we don't have the revenues coming in, is local appropriations. And, up until this point, it has really been solely covered by Benzie and Leonard counties. And I think with that, I'm going to hand it over to Mike to talk about some solutions.
So as you've heard, 16 started really a regional approach to this kind of grassroots, and I reference it a lot of times like this is the grout in public health, right? So we have these funding streams for program, essential local public health services is what Michigan Department of Health and Human Services has titled that, but this is really connecting, whether it's our programs or other programs in the community that are working in parallel with us, doing a different service, but hitting that need, filling that gap where, these stories can go on for some time. I met with staff, our entire staff just yesterday, and had some stories shared with me as well about things that just this week in regards to referrals for folks that live in our community that need assistance with housing or food or transportation or dental services. So I'm very thankful to Dan. This is the second time we've met today or this week. We sat together on Monday to troubleshoot some other problems that local health departments are facing. So as Dan mentioned, we sat together through the duration of '24 to find a solution for this. Ideas came of that, and we would like to address this for 2025. In doing so, The Grand Traverse County Health Department, we have identified funds that we receive through the Michigan Department of Health and Human Services that can support this work. We've worked with our state partners to ensure that we can do that. And we would like to make that step. And that step is through an interlocal agreement here between Grand Traverse County and Benzie-Leelanau District Health Department, knowing that we're going to be continue meeting as health officers and leadership in public health, advocating with the state health department for some of these other grants and some of this other work so that we can create a sustainable model beyond just the health department being able to use some of its grant funds, or in our case, some of our local appropriations to fund this program. So some of the work we're doing as well, advocacy to increase that Medicaid reimbursement, as it says, that's a lift. It is a lift to manage those plans and to negotiate them. Long-term grant funding, as I discussed, we were working together as recently as Monday on that. And this contract here is another short-term solution that we have identified. So the proposed contract that we have in front of this board here today for approval is an interlocal agreement between the two health departments to support in that funding shortfall that Dan had mentioned. So Grand Traverse County would pay the percentage of county residents utilizing the services to in accordance to that shortfall, up into $95,500 a year. And this would be a year-to-year contract, obviously with an option to renew each year. The year-to-year contract is just because of the changing landscape of grants and managing through it. It would be best to just keep addressing this each year and take a big picture look at how are we going to put a runway together of creating a sustainable program here. So with that, we're seeking this board's approval here today to enter into that contract, and would like to answer any questions that you may have.
Thank you, Mr. Leahy, and everyone for your presentation. I'm a big believer that, what do they say, an ounce of prevention is worth a pound of cure. That's applicable. Any comments, questions, concerns for the group? I'm going to start at that end. No. Commissioner Walter, if you please.
Yeah, a couple, thank you. It says in the memo that this is already part of your budget, or it's budgeted, it's not coming from general funds.
Yep.
And then if I look at the resolution, the interlocal agreement resolution, it, contract is commencing on January 1st, 2025, and concluding at the end of this year. And I just heard you share that it's going to be with an option to renew every year. So does that mean that during budget time, you'll include it, you're likely to include it again? And then will we need to look at another interlocal agreement starting so that it can continue in January? What do you envision that process looking like?
So in regard to the budget, yes. With the funds that we've identified, as long as we can ensure those are sustainable, right, they will be factored into our budget at the local health department. It's a little bit of a moving target too in regards to the shortfall, right? So we'll never fully have that picture when our budget is complete, but we'll be allocating the money there to cover what we can, right? Option to renew, so we have a number of interlocal agreements with the health department. I have a few coming in April and May that are just renewals of contracts. We have some with Munson, with some other Healthy Futures, and we're on the 21st year of a contract renew. So I don't see any changing of the language of this contract if this is how we continue to support the program. I just wanted to give an option for both departments that if funding really becomes an issue and we're having a difficult time identifying that funding, that we can come to the table as both health departments and talk through what the solutions can be moving forward. Because we can see this has a bigger impact on just Grand Traverse County too, right? You saw the map with the 31 counties, and there is a lot of advocacy going on right now in Lansing about, this funding need and what's happening here, right? What's the miss that is created with that funding gap now? So, and things are changing kind of by the day and week. So, I didn't want to commit us with our budget for much longer than that, but it's our intention to renew each year as the funds are there.
So it's my turn. Do you have any
Commissioner
more
Smith, yeah.
questions? Okay. Is there any overlap with the Northern Michigan Community Action Agency? They seem to do some of the same things that you've listed.
A bit.
Yes, so we do referrals back and forth with them. If we have folks that are looking for weatherization or need Head Start, and that kind of stuff, they're the ones that house the street outreach for the, through Goodwill, that line through there. So we are partners with them for sure. Like I said, we don't have funds. They sometimes have funds to help with some of
Okay.
this. So we do referrals back and forth with them.
That's good to know. And then about the money, the contract says it would not exceed $95,500 per year for Grand Traverse County. So then when we renegotiated a contract next year, would that number exceed 95.5?
I think time's going to tell as we enter into that next contract what the budget landscape looks like. So, I'm cognizant of, financial responsibility here and making sure that we have the funds for it. So I just want to ensure that both departments can afford the program, right, to run. As we said, it's a free program. There is no revenue generated here with, so I think that's something Dan and I would have to sit down and talk through into 26 and 27. So it's just that's why we deferred to go to a year-to-year contract.
Yeah, so then I was thinking, like, if you were to come back to renegotiate the upcoming year's contract, we'd probably want a little time to look at the numbers and consider what's being asked of us. So when would we be presented with that future year's contract?
Yeah. Much sooner than now, I guess I'll say that. We're coming to the table solving a problem that was for 24 and beyond. So here we are in this month. So I anticipate this closing out at the end of this budget year as we identify what the final number is, and then bringing this forward as we complete our budget. And we have a number of contracts that we just renew on an annual basis, so weaving that into that.
Okay. Hey, I just want to finally say, I'm with you, I hear you, and I understand with the cuts to the Department of Health and Human Services, I see how it's trickling down to our local level. So I'm open to hearing your requests, and thank you.
Thank you.
Commissioner Nelson?
All right, thanks. So the 95.5 in the resolution, that's coming out of funds you've indicated other than budgetary.
Yep.
In the future, you're going to look at those kind of funds, may or may not be covered.
Yep.
And I just want to put a point on that because you've stated that, and I want to make sure I understand that. With that in mind, I want to make the motion that's on page 20 of 20 and that link for the Health Department Community Connections Grant Universal Hub Interlocal Agreement.
Second.
Commissioner Now, I'm sorry, what?
You say you can give it to Commissioner Walker.
Variety of the spice of life. Motion made by Commissioner Nelson and supported by Commissioner Walter to pass as presented. Any other comments, questions?
I've got a few.
Oh, my goodness sakes, shock.
Sorry.
Commissioner Andrews.
Yeah, thank you. First, just to clarify, thank you for ensuring continuity in this program. It's obviously, when programs like this start and stop because of funding issues, it creates new problems. So the fact that this contract is coming 4 months into the year, I expect reflects your desire to keep the program going while you figure out a solution, and I think that's a good opportunity, even if it makes the lawyers in the room a little bit uncomfortable to sign contracts that are predated. Clarification that even though Benzie-Leelanau Health Department is the sort of administrative hub, the services are provided for Grand Traverse County in Grand Traverse County, is that correct?
Correct.
Okay. So our health department, our dental services are providing these services. Thank you. The transparency and in data on your website is to be commended. It is phenomenally deep and comprehensive, and I encourage anyone to go to that link. It's in the packet, and it breaks it down by every hub and by every county that participates in this program, and for years. Goes back at least 5 years. So I think it's a phenomenal resource. I appreciate it, and I just have a couple of clarifying questions. It looks like the medical providers are well aware of this program, just judging by the referral sources. But it looks to me like our community-based organizations are lagging in this respect. And I'm expecting, for example, Commissioner Morris is an active participant and leader and advocate for Bed Bath & Behold, which is holding a drive this weekend and provides resources to people who are recent to housing. Can they participate, and how do they participate, and how do you ensure that they know they can refer and participate in programs like this?
So that's one of the resources that we use. Our community health workers are well aware of and refer folks to that program, so thank you for being there with that. I will say, in the last year and a half, it's been more heavy with medical referrals because Munson made it just automatically as part of their EMR, so those referrals really increased. Before that, it was heavier with the community-based organizations. We used to do a lot of outreach and making sure everybody knew about us. As we got busier, we haven't done as much outreach, right? So, but it still is open to everyone, and just go to the website and click on the link, and anybody can make a referral.
So if someone walks into the clinic seeking sheets and towels and has a conversation with whoever's staffing that, that person
They can go to that website, and they can either do the referral for that person with their permission, or they can give the link to the person, the client they're working with, and they can do the referral themselves.
It looks like one of the reasons that of the never enrolled, the biggest reason appears to be unable to connect. Can you unpack that for us?
Yes, and that also really increased last year. So when we get a referral, and I should have said this in the earlier slide, we do 3 attempted contacts. So we call them, we then send a letter that has our flyer that kind of legitimizes who we are, and then we try to call them again. If we don't get a hold of them after those 3 contacts, we close them out, unable to contact. We saw a big increase when the hospital started sending all these referrals, that we just couldn't get a hold of folks, or they didn't really know what they were signing up for. And so we're right now doing a project with Munson, with their frontline workers who are doing these screenings and sending the referrals to make sure that they understand what the program is and that somebody's going to be calling them. We did this with the physician offices when they first rolled it out, and now it's with the hospital. So as you might imagine, it's a lot more people involved to try to understand, and we're talking about the difference. Do they just need 211? Do they just need information on something, or do they really need a community health worker to come and work with them? So it used to be our acceptance rate was like 50 to 60%, and then it has dropped down more recently.
It looks like translation services are the biggest pathway opened. Can you explain how you provide that service?
So we have 3 community health workers who are bilingual, Spanish, English, and so they get a lot of referrals and do a lot of translating for those folks. And part of the reason that pathway is so high is because each individual translation service is its own pathway. So if they're doing it at the doctor's office and then maybe at the health department, one of the nurses, we work with a lot of the pregnant folks who speak Spanish, and so they do a lot of assisting with that. And so each of those are individual, and because we have that capability, we do a lot of that.
And last question relates to housing, which is obviously, as we know, and as the data reflects, one of the top referral reasons. Who do you collaborate with in order to help people and try to connect them to housing?
Anybody who's out there who will work with us. So a part of that is even just helping them build a budget. So we have, along with all the pathways you saw, we have a lot of learning modules that come with this, the Pathway Community Hub Institute model. And so there's a lot of education things. One of them is around budgeting. So it's figuring out what can they actually afford, and do they really, is it more likely that they need to rent a room as to, what can they afford, what can they do? We work with the Housing Commission. We, do the Section 8 applications. It's a lot of, they're on the road, and they even see the signs that are, if somebody drives by and sees a sign for rent, it goes in our group chat, so everybody knows that it's there if somebody's looking for something in that area. So yeah, it's trying to be creative with what their options are. realistically and what they can do.
Thank you for presenting today and shedding some light on this important program in our community.
Last call for questions, comments, concerns?
I would like to thank,
Well, typically, we don't allow that during this process, but we, is it less than a minute? Yes, absolutely. Go right ahead. You have to come up and identify yourself and ask your question.
Dan Messerschmidt, DO. I just have a quick question. We all have case managers embedded in our practice.
You gotta say it on the microphone so
You gotta
people
talk
can,
to us.
you gotta talk to us.
We have
No,
case
you gotta talk to
managers
us.
embedded in our practice, and all of our case
Jan,
managers.
speak into the microphone.
All of our case managers have your information, I know that, but do you ever pull those case managers together, because there's so much duplication of service, together to say, here's what we do, here's what you do, how can we put this together so that our dollar goes further? I mean, that's massively important. Number one predictor of who's going to wind up homeless, if per studies, is that the people who smoke and people who do drugs, because it's just mismanagement of funds. So we get
Okay,
these
that's a
people,
minute.
and they need to go through budget, how to learn how to budget, and that has to be a part of the program. So, get a Marilyn Gibbs.
Thank you for entertaining that.
You want me to? Okay.
I want to thank Dan. Dan, I appreciate you working with Michael and addressing the shortfalls the way that you did. We appreciate that and your partnership with Benzie Leelanau on this very important initiative, and I think we're looking to expand our cooperation with you through the connections, and just want to say thank you. And thank you, Debbie.
Appreciate it. Thanks, Nate. We've had a long history of partnership and cooperation. I think, at one time, Grand Traverse, Benzie, and Leelanau were one health department many, many years ago. So, I mean, we've got a lot of shared, experiences, and even some people that are still around, I think, maybe that. Yeah, we're there. Yeah, Deb. Actually, Deb, she used to be Grand Traverse nurse, right? So
What is the uniqueness of a single county health department in the state of Michigan?
the uniqueness? I think the uniqueness is that the Board of Health is the Board of Commissioners, where a district health department is a partnership of counties to, typically share costs, and there is a Board of Health, which is made up of at least 2 commissioners minimum from each county. Benzie and Leelanau is a little bit, I think, is a leader in the state. They're one of the few, I think, maybe even the only health department Board of Health that has 2 physicians on the Board of Health. So.
I appreciate the assistance for 24. We look forward to working with you in 25 and 26 and beyond.
Likewise. Thank you.
Thank you. So let's do a vote. You don't have to do a roll call, right?
No.
Good. All those in favor say aye. Aye. All those opposed? Thank you very much.
Thank you, Michael.
Very much
Thank you
appreciate the
for your
support.
presentation.
Thank you very much.
And your continued good work. Okay, we're going to go to 10A. So I was asked a couple of times, or I apologize, a couple of commissioners have asked about a liaison between this board and the County Road Commission. And I had Lisa Emery and Bonnie Shealy looked it up. I've been the only one that they've ever had officially. And so in that vein, I'm going to propose that we'll continue to have one, and I'll be that one, and I'll make that motion. It needs approval by the board.
Support.
Comments, questions, or concerns? All those in favor say aye.
Aye.
Opposed? Thank you. I know it's not on here, but I have had a request from Commissioner Flynn and Commissioner Spence for Commissioner Flynn to leave the TTCI board and Commissioner Spence to take her place. Is that still a thing?
Yep.
All right, I'm going to make that motion now.
Can you explain the rationale for the change? Sorry. And I second.
Cares? Just let them do it.
I just explaining to the community what I want to
I
do.
feel Commissioner Spence has a lot of experience with planning, and I have I'm on many committees with Networks Northwest, so I felt that it would be a good fit for Commissioner Spence.
All right, any more comments, questions, or concerns?
I have a question.
Sure thing.
So.
Sorry, that was fast, and I apologize.
Yeah, it wasn't on the agenda. So we are doing what now?
So the Board of Commissioners appointee to the TTCI board has been Commissioner Flynn. It'll no longer be Commissioner Flynn, it will now be Commissioner Spence, effective
Okay.
immediately.
Well, if we approve it.
If we approve it. My apologies, thank you.
That's the intent, yeah.
Yes, that's the intent. Thank you very much for that.
That's all I had. Are you just doing one motion for the two things?
Well, this is the second motion. We already did one for the liaison. Oh, you mean for removing Flynn and putting in Spence?
No, no. Go ahead.
You're all set. All those in favor say aye.
Aye.
Opposed? Fantastic. Absolutely. Let's take a 10-minute break. Thank you, everyone.
Hey, thank you.
year, but this last couple of years.
Carolina, Tennessee. No, Liz, want to go there in the spring. Just get out of April.
Morning.
Like, it's the afternoon one that comes. But she has rehearsal most.
Let's do us on the 6th. We're going to come back into session, everyone. We're going to go moving right along. We're going to go to 10B, the revised ethics policy. A little background on this real quick. In February, we had a study session and a meeting before that where we had some direction. Our civil counsel responded on the 6th of March, and you have this before you with a couple of options. And I'm going to go right ahead, and I'm making a motion that we approve the ethics policy as presented in option A. And for the record, when I can find it, option A will be the chairperson of the Board of Commissioners or the vice chairperson. If the complaint involves the chairperson, shall appoint a chairperson and 2 additional members to an ethics panel. The members of the ethics panel may be a member of the Board of Commissioners, an employee of the county, or any other suitable person. In naming members of the panel, the chairperson of the Board of Commissioners shall consider the nature of the complaint and the identity of the person or persons complained of, and shall endeavor to select persons in a position to render independent, informed, and considered judgment. Do I have a second?
I'll second it.
All right, so that was Commissioner Spence. All right, so we have a motion by Seifert, a second by Commissioner Spence. Comments, questions, concerns? Commissioner Walter.
I'm okay. I'm not going to die on this hill of whether it's a standing panel or not. I'm okay. I'd prefer a standing panel, so it's a little less potential for bias. And yet, I think this proposed policy is better than what we got, so I'm happy to see some improvement. It's not perfect. And so I'd vote in favor of it, even though I'd prefer a standing panel.
Thank you. Anyone else? Comments, questions, concerns? Commissioner Morris.
I would echo those sentiments. I also believe that a standing panel might reduce the possibility of bias, but again, I wouldn't die on that hill either.
Anyone else? I'd like to respond to that, if you don't mind. I thought about that, and I agree with that, but my concern is that, so let's say I'm the person, that's the nature of the complaint, but I'm the one that helped appoint the standing panel. So therefore, by the very nature of the oversight, we'd have to approve another panel. And I don't like doing things a couple of times. I think it's a waste of the taxpayers' time and their money. That's
why would you have to approve a different one? I'm not following.
Because if I'm in part of the approving process of the standing panel, and I'm the subject of the investigation, There's conflict of interest.
Are you anticipating causing trouble?
I can neither confirm or deny that, Commissioner Morris. And again, this is why you sit over there.
But even, so you're saying, okay, let's see, is there a
Yeah,
example?
I'm willing to be the
Okay?
sacrificial lamb.
I'm just gonna continue going down that road. So, so there's not a standing panel, something comes up, you're the focus of the investigation or whatever, complaint.
Sure.
And our board still has to approve a panel, would you then not vote on it?
Well, that would be the subject of time, but as I was talking earlier, off the air, there are 9 commissioners on this board. So if I'm the subject of the investigation, I have 8 commissioners that are my oversight. You know what I mean?
And also, it's the, option A says the chair appoints unless it involves the chair, in which case the vice chair appoints. So it's not a board decision under either option A or B.
So even the appointment wouldn't come to the full board? We wouldn't have a say? So I don't like that, because that also opens it up to bias if you're going to appoint somebody and then none of us then have a chance. I mean, I would probably be okay with it, right? But
That's a
any
valid.
vice chair, then none of us would have a say in who's on that panel?
So I think I would argue, and if our attorney is available, he will undoubtedly correct me if I'm wrong, our board rules allow the board to overturn a decision of the chair by vote of the board. So I expect that that would be triggered if this, so let's say, let's just hypothetically, right?
Yeah.
Commissioner Chair Seifert is the subject, there's a complaint, I appoint, whoever, anyone on this board thinks that that was inappropriate, this board can then say, I move to overturn, or I appeal the decision of the board. And if at least a majority of those who are voting, we've never done this, but it's in our bylaws, if a majority say, yeah, we should appeal it, then you can.
But it's not a decision of the board that we're appealing, because the board
No,
didn't.
it's a decision of it's a decision of the vice chair who's
Right,
acting
so
as the chair.
Let's confirm that that's okay with Matt, because it's not a decision of the board at that point that we're overturning.
No, decisions of the chair can be overturned by a vote of the board. So any decision of the chair, so let's say the chair voted to stop public comment, and our board wanted to hear that public comment, or we can always vote to appeal and overturn a decision of the chair. So, but with that, go ahead,
Matt.
Matt.
Bill? See you talking, but.
I hear you.
Oh, now, Matt.
That is correct.
Okay.
Does that satisfy your question?
Yeah.
Fantastic. Thanks, Matt. Any more comments, questions, or concerns? Bonnie, I'm going to do a roll call vote, if you please.
Spence? Yes. Walter?
Yes.
Flynn?
Yes.
Morris?
Yes.
Andrews?
Yes.
Nelson?
Yes.
Seifert?
Yes. Thank you, everyone. Thank you. Any new business? I know there isn't any agenda, but sometimes we miss things. Fallible that we are. All right, move along. Commissioner Department reports. We'll start with A. I believe that's you, sir.
So there was a request through the commission that we entertain the concept of having a facilitated discussion with the commission. We did this, and I'm trying to recall the year, but Chris and I were-
2021.
2020, thank you, Commissioner Morris. 2021, where I believe it was John Amrine through MSUE came and facilitated a discussion with the commissioners, and it essentially was a strengths, weaknesses, opportunities, and threats discussion that the board engaged in, and they found value in that discussion. It helped enlighten each commissioner about other people's interests, their ideas, their concepts, their concerns. And Commissioner Morris has requested that we consider doing that again. If this board pleases, we will certainly move forward to try to engage somebody. Mr. Amrine has left MSUE largely. I believe he works 0.8. He's a 0.8 FTE, so he works like less than 8 hours a week. But if this board has interest, I'll certainly look to find somebody that can come in and do that facilitated discussion, likely off-site, kind of a team-building atmosphere.
Maybe you can enlighten me, what would the end result be of this SWOT analysis, or what's the goal product that we would get from it?
The value that we found in it before was kind of reaching directional consensus from the board, because we relied on a lot of community input, things that we'd been hearing from the community, and we looked at what our strengths were, our opportunities, and how can we move these ideals forward that we're working on as a board. The biggest value was the team building. It got us all moving in the same direction and on the same page, and maybe not arguing over the little things, but pursuing the big picture. And I thought that would be a really great value for this board.
So it would help create a guiding plan for the Board of Commissions work together, like top 5 things we all can agree on sort of thing? Is that what you're envisioning? Kind of?
That's part of it. Yeah.
I'm sorry, Commissioner Spence?
And that came up at the MAC conference. It was one of the final sessions for the day, was basically the same thing, like finding out how we can work better together. And I do like that element, but one of the elements I think would be really good to add to it, if we do hire a facilitator, is someone who can help us organize the so many projects and so many departments that we look over, to really streamline those into a spreadsheet where we can identify each of the projects that are ongoing and where we have left off with, and what dates we've left off with, where we are with them. And I think it all ties in together, and I think it could tie in together. I think it would help us function really efficiently if we had a nice screenshot of what we're dealing with, the many projects, where we are with them, and what the next steps are. And I can see that, I can visualize it, but I haven't put that together, but I do think a facilitator that would help us with this SWOT analysis could also help facilitate that as well.
What action does the administrator need from us? It sounds like there's general consensus that this is a good idea.
Commissioner Nelson.
So when I joined the board in 2021, I asked for this, pushed for this process. I've been through it several times. It always has some positive results, and I felt that it was very good for the Board of Commissioners to go through it at that time. You don't necessarily have a stated goal of outcomes other than getting together and having this conversation. A good leader can take you through it. You don't necessarily want to have a finite funnel at the end where you go. You kind of see where this goes. But the team building and the collaboration that comes from this is usually very beneficial. So I'm in favor. And I would like to include members of the administration team, would be my hopes as well, if that's others are in agreement.
Great, certainly. So the direction we need is this: we need consensus, and what we will do is we'll reach out to identify a facilitator and get that scheduled as soon as we can.
You have a question?
Did we let the public know what the acronym SWOT stands for? Because I don't know.
SWOT is S-W-O-T. It's strengths, weaknesses, opportunities, and threats. It's
not a group of guys with guns.
Correct. That's S-W-A-T. Maybe an unfortunate acronym, but regardless, we do this quite frequently internally with departments to just kind of learn, what they need, what they have in terms of resources available to them, but ultimately what they need to do their job more effectively and more efficiently. We kind of did it yesterday with 50 health department members. We talked to them in a town hall meeting with Mr. Leahy, and just listening and hearing their challenges and their concerns. But there's value to it. We don't often, we hear your votes quite frequently. Sometimes we don't know why. Why did we vote that way? And it gives you an opportunity to kind of have an insight into each different opinion of commissioners and what their insights are and what they feel is important to them, so that as the board goes forward through their discussions with the various items that are presented, you have an insight, if nothing else, an appreciation for why somebody may feel a certain way or think a certain way. So I will reach out to John Amrine first of all to see if he's still able and willing to do that through MSUE, and if not, we'll find somebody to do it.
It is something that's in the budget for us to hire a facilitator, professional development kind of thing.
It wasn't contemplated, Commissioner Walter, but I know that there are contingency funds within the Board of Commissioners, within the Board of Commissioners budget for some things like this. So the cost would likely be minimal, but the value in it, I think, is worth it.
I'm going to bring pie.
Pie?
Pie. You don't like pie, you like cake, right?
I like pie.
Oh, okay.
I like cake too. Is there a reason?
Chicken pot pie, cherry pie.
Well, I'll probably buy the pie, then I have to have somebody make the cake. If you've ever had my cake, you don't want it. I never made it for you.
You're not selling the pie either, I guess.
No, no. So it could be cake too, I guess. Fine.
Motion.
We doesn't need a, yes, an emotion. Might need to be. Okay, Commissioner Department reports. Commissioners have anything? Penny, I'm going to start with you.
Sure. Northern Lakes Community Mental Health meeting is tomorrow at 1. It will be at our Hall Street location, and lots of interesting, fun things to discuss.
Can I do both meetings tomorrow? No. Beta meetings tomorrow, one as well. Commissioner Flynn.
I just want to state, with public comment of housing being so important, Northwest Michigan Supportive Housing is having an event at the Dennos Museum on May 6th, so you can RSVP and let them know you're going to come and support them.
Commissioner Walter, if you please.
Yeah, the work group, I think we're a work group about opioid and cannabis dollars process, is tentatively meeting on May 6th at 2:30. I think that's what we had agreed on. I'm sure something more formal will come out, but I wanted to get that out there, and then if it changes, we'll let people know as well. Yeah, big day.
Busy day. Thank you. Commissioner Spence, you have anything to add?
Public comments and the public hearing for the septic code is coming up April 23rd. And it's a good time for the public to offer their feedback about that.
Fantastic, thank you. Commissioner Nelson, please.
I wish everyone a good, happy, blessed Holy Week.
Thank you. Thank you very much. Commissioner Andrews?
Yeah, I just wanted to give everyone an update. As you may remember, we have a Materials Management Planning Committee and process that we've just kicked off last year. We are collaborating with Leelanau and Benzie on that after some I wouldn't say we had the rug pulled out from under us by Eagle, but maybe we did in terms of the funding method for this. The funding is still there now. It's on a reimbursement basis instead of an upfront basis, which really complicates it when you've got multiple counties, but that's been worked through. Our initial submission was due, and we got that submitted. Eagle accepted it, and so we are now off to the races as a committee. We've done our sort of foundation work. We have put out an RFP to provide support for our planning process. And while that process works through, we have another consultant that's helping us do some teamwork and level setting and coming together to figure out how we're going to pull this off as a committee. So we've got a couple of months while the big RFP moves forward to work forward and build this team into have just sort of an understanding of what it is we're trying to do here. This is a new process. I feel like we're all coming from very different perspectives by design, right from elected officials to people who are immersed in materials management to haulers and recyclers and composters and others. So you'll undoubtedly hear more about that, but that's definitely moving forward in a positive direction. We have great support from Lydia Goodlow. Our resource manager is sort of the lead on that. Chris and Maxwell are helping with that. and we're, got a lot of support and positive. Yep.
Just want to recognize Maxwell and Lydia, who they're doing the really great work. And what we're learning is that even though, as Commissioner Andrews said, Eagle has been difficult at times to deal with, statewide, I feel like we, together with Benzaleel, we're ahead of the curve, and we're making great progress in developing what should be a really, really thoughtful, good plan.
Commissioner Nelson?
I had one more, if I may.
Oh, absolutely.
So, April 24th, 5:30 to 7:30 at the Dennis Museum. Again, I want to remind everyone about the Coalition to Combat Human Trafficking Awareness event. Contact me if you need information to how to attend this. It is a fundraiser, but there will be some a panel of speakers and some other good information there. I just want you to know I'm involved with this organization, and it just, quite frankly, pisses me off that it's going on and right here in our community, or it happens anywhere, but it's happening in our community with both male and female. In the last week, there have been incidents with both where people have been helped. So it's right here, and we all should be aware of it, so
Thank you.
we can stop it from happening.
Well, I'll see you there. Yes, I share your sentiments exactly. Nothing else? Nobody talked about MAC last week.
I was going to let you, but.
Oh, thank you so much. Usually I'm doom and gloom, but after spending a couple days at Lansing, I'm like, we're not getting any money from anybody. We're on our own. That's the prognosis. Federal government, state government. So on a positive note, we did have a little soiree with our neighboring county commissioners and a few extra people that turned out to certainly opened the bridge of communication. It turned out really, really well. I had some great ideas, and I was very glad that we did that. We're going to look to do that again in the fall. And so that makes us very hopeful as we wrestle with state and federal budgets that are ever shrinking, as we've heard all day, almost all day, or all morning this morning. But it was a great resource. I really appreciate MAC and all that they do, and it helps us out a lot with the lift. Other than that, I do know that one of my townships is looking at a farmland preservation program. It's in the initial stages, so I thought that was great to hear. And it was very well attended. There must have been 50 people in that little itty-bitty room. That was great. So, but that's pretty much all I have. Nate?
A couple dates to keep in mind. Next Wednesday is a study session dedicated to discussing the FMP, where Cunningham Limp will be in chamber talking about costs and other items that you would like to discuss through the FMP process for Project Alpha. And we'd also like to dive into a larger discussion about next steps with jail and things like that, just to try to kick those ideas around a little bit so we have better direction. That is also the date, as Commissioner Spence mentioned. It is the date that we will have a public hearing on our septic ordinance. It is a study session scheduled as such at this point in time. If this board chooses to take action on that date, we will have to make that a special meeting. But there's no action necessary at that moment. It's just a study session and a public hearing. May 14th is, that's a Wednesday, I believe. In the morning, we are going to have a joint session with the city of Traverse City in this building, and Tower Pinkster will be present to provide discussion on the facilities assessment and the facilities master plan. Truly walk us through from the basement up, just to give us an idea about this building and some of the needs and opportunities that we have specific to the FMP and facilities assessment. So
May 9th?
May 14th.
14th, sorry.
With the moving forward with the removing of the privilege to the Cole Stoker opinion for the Board of Public Works, I will be providing a public consumption document to Chairman Shaw of the BPW so that they can review that and have that in their possession.
That probably won't be be available for tomorrow morning's meeting.
I don't know that that would be the case, but we could at least talk publicly about the opinion. I know what it says, and we've kind of given the BPW an overview of what that looks like. I have heard that there were questions about it at the Finance Committee level of the Board of Public Works, and I will be able to address questions. I'm hoping to attend that tomorrow. They have a BPW meeting tomorrow, and I have a calendar, so I don't know if it's going to be possible or not, but I'm certainly going to try.
What time is that?
Daryl, when is that? Commissioner Nelson, when is that?
Tomorrow morning?
Tomorrow morning.
Tomorrow morning, 9 a.m.
Yeah, 9 a.m.
In light of our action to waive the privilege on that, isn't it just a matter of striking through the privilege? And isn't that something we
Yes. Short answer, I think is yes. When I talked to Matt about how that would look, previously, Cole Stoker created a different document that was for public consumption. But Matt, do you have any opinion on that?
Well, I'm sure you guys can figure it out. It just seems like if there's a meeting tomorrow, and since this action's been taken.
Nate?
Yep.
We'll just put privilege waived at the top and reissue the same, it'll have the same date, same content. We'll just document that the privilege has been waived.
All right, great. I appreciate that.
Okay.
So that's kind of where we're at.
Thanks. Anybody else? No? Fantastic. Second public comment.
Sounded like Nate maybe had something else.
Oh,
He
did
looked
you?
like he was
I'm
ready
sorry.
to talk.
Did I miss the?
Well, yeah, you did. Just we're looking to kick off the budget process. We've had some good internal discussions and discussions with the chair and the vice chair about potential opportunities here. Just so you know, if you have questions, if you have wants, or you want to see something now, please don't hesitate to give me a call or an email asking for specific information. At the next meeting, next regular meeting, Mr. Bada is going to provide you with some financial analysis of how 2024 shook out. And, we're still within the audit, and that audit report won't come out until July, but Dean has some preliminary information that he would like to share with you. Thank you. Thank you.
Thank you very much. That's it. That's it?
Sorry.
All right. No worries. Sometimes I get ahead of myself and everybody else. Excuse me. Second public comment. Anybody like to comment at this time? Going once, going twice. All righty. Notices. Mr. Elger.
The NCS National Survey is out. People are receiving it currently, and they have from April 17th to May 8th to complete that survey. If you did not, for the residents listening, if you did not receive a postcard and in the mail or a request to complete the survey via mail, there is a online opportunity, and we have a QR code on at our website. Next Coffee with the County is on April 29th at 9 a.m. at the Senior Center located in Traverse City. And the next day of that, April 30th, is the grand opening for the Senior Center in Traverse City. And then yesterday, the Grand Traverse County brush site on Keystone opened up for brush drop-off purposes.
Fantastic.
And the road commission wasn't here, but I do want to say I heard, and I believe this is true, that a crew or crews from the Grand Traverse County Road Commission did go north to assist with the remnants of the ice storm. So I know I've heard appreciation for those efforts. I just want to extend that to you.
Thank you very much for sharing that. Been quite the mess. Debacle. Anyone else? That's all? Adjourned?
Thank you.
Thank you.
Have a great day.
We are adjourned. Thank you, everyone, for participating today.